Good morning from Circuit World in downtown Blue Ridge. It is time. I'm your host, BKP. It is time for Ask the Doc. I can turn my phone down.
Oh, yeah, please.
Yes, please.
It's an April Fool's, though.
Yes, I'm afraid of that.
Speaking of April Fools, what is with that chair?
I don't know. I mean,
How about that chair? They called it the love seat.
easy.
You can't see this on camera, but BK, if we find you in that chair, we're retiring you. Okay?
What?
We're retiring you if you end up getting in that chair. It's what people can't see. It's a lift chair, and it for those who can't get out of the chair by themselves, it kind of lifts them up and gives
And
them a
it
little.
throws them forward.
So there you go, BKP.
That's a medical device.
This is called Ask the Doc with Dr. Raymond Tidman and Dr. William Whaley.
It's the other way
Dr.
around.
Whaley. No,
It's the other way around.
I went here first so I could come over here and focus. And
Oh, I
like,
see.
who
Oh,
is
You're
that
on
guy?
his right. You're his right-hand man.
I went this way. But you know what? I'm thinking about that chair. I'm actually, there's something about
It's terrible, isn't it?
Huh?
It's terrible, isn't it? He put it there as an April Fool's joke because you got so much.
All right. So
I'm
anyhow,
not going to say anything about it. See, Ray was.
every week we get some great questions, and Dr. Whaley focuses and really brings graphics and charts and algorithms and survival curves and everything to answer your questions. But we always thank Georgia Cancer Specialist, Northside Hospital Cancer Institute for this segment. Guys, before we start, what's that yellow stuff on the hood of the cars that's causing the...
That's called blow your nose, my eyes run. Actually, that stuff on the car does not cause you to do anything.
That's the
pine pollen.
Pine pollen. You can't even
Pine
get that.
pollen's heavy. So it's the grass pollen and the tree pollen that's making Ray blow his nose.
And it's the dogwood blooming now, and that's the most intense.
And
That gets you now.
It gets me. That's my intense. That's my 2 weeks of
some
intensity.
of the grasses get
you have 2 weeks because what's happening is here this past 7 days or whatever, we're starting up our lawn mowers for the first time of the season. We're spinning that grass.
We're 12 days behind, people that are 60 miles from us because we're 450 feet higher.
I take my daily allergy pill.
That's good. Clarinex.
I take it.
They take the generic one, 365 tablets for $14 at Costco, or you could go to CVS and pay $30-something dollars.
See, not only do you get good at medical advice, he shops it out for you.
Yes. Also,
Cheaper Costco.
you ready?
Yeah, actually, this first question.
No April Fool's jokes, please.
No, we talked about that. We talked about that in the green room. I want to stay away from that. This first question, when I read it, I talked to my nurse about this, and she says, I'm confused. So this guy's confused. One of my nurses is confused. All right. So I am confused. You have talked for years about tumor markers and following them with prostate, colon, and ovarian cancer. You talked about cancer of unknown primary. That was 2 weeks ago, if you'll remember. We were talking about stains. And about stains and things to tell you where the cancer came from. So that's the background. My brother has lung cancer and has been treated, so apparently he has done well. And he now has a small spot on a scan near his heart. The radiologist says he cannot biopsy it. But we've always said, radiologists can, with the needles and the scans, they can biopsy just about anything, even where there's Latin names. But if the radiologist isn't going to biopsy that, you can dead go and believe it's in a bad spot. The oncologist has suggested a blood test called a liquid biopsy, and that is very expensive. What should my brother do? Well, I'm going to tell you probably should take the liquid biopsy because that's what the oncologist said. But this points out several different things, and one of them is that the reason that that's very expensive is because the oncologist is required to tell you
It's not covered.
Get you to sign a paper that Medicare might not pay for it. Now, my experience is that if we fight with them, it's going to get paid for, because we're going to talk about the cost here in just a minute. All right, so put up that first got to always begin with a
Algorithm.
all right.
You know, I know you're going to cover this, but I'm trying to think, and I'm serious. I'm thinking back in all the questions because I read along with you, and I'm thinking back. When have we ever had a question that said liquid biopsy?
We talked about it. We talked about it.
I don't remember one.
I don't remember one.
We did talk about it. We didn't use the term.
Okay, because I'd like to
We
know
talked about
what the difference.
circulating tumor cells. We talked about when we talk about lung cancer markers, because that's going to come back up in a minute.
Can I
Sure.
digress for just a second?
Sure.
Because we talk about algorithms all the time.
Yeah.
And you bring them with the meetings, and they're very important. But for the young students, medical students, or people aspiring to that, it is important to understand that an algorithm is a sequential layer decision tree to help the physician remember to cover the different aspects.
Correct.
It is not the director of care or
No.
of diagnosis.
No.
So we talk about it with a certain amount of reverence, but it is just a mental
Correct.
note-keeping fashion.
It's like the bones of the hand, which are it's never lower Tilly's pants. Grandmother might come home. Now, if you remember that, then that's navicular, lunar, Tilly's. That's what So it's like those things you keep in your head.
It's a mnemonic for keeping things
But just
straight.
think, how long has it been since you thought about never lower Tilly's pants? Grandmother might come
Thank
home.
goodness.
I
Thank
was in
goodness.
medical-
35 years ago.
I was in medical school 56 years ago. I have not thought of that, but it doesn't ever go away. If I needed to come up with the bones of the hand, I'd look up never lower Tilly's pants. Well, this is a little more fancier way of working your way through some way to do something. So this is the one we had with cancer of unknown primary. Remember? So if it's above the diaphragm or below the diaphragm, and then you have all of these different stains, you can pull that down a minute because we'll just talk about it. You have all these different stains you do to tell you, okay, this looks like it probably came from a breast. And so if you got a lump in a man's lung, like we discussed before, you biopsy it, it's an adenocarcinoma. That could be gastric, or it could be lung, it could be pancreas, or anything else. But the markers might direct you to breast cancer, and it's male breast cancer, metastatic to lung. We had one here a few months ago, and he didn't have a lump in his breast. Had a mammogram and there was nothing he could find in his breast. But this was clearly a cancer that came from one little 2 or 3 cells in the breast. So anyway, that's what they're talking about there in terms of the stains. Put up the next one. This is a beautiful color picture. But this is a variety of different cancers and different markers that have been associated with them. And I'm going to go first to the lung cancer, and you'll notice that it says CA125, that's an ovarian cancer marker, and it says CEA, that's a colon cancer marker, and the association of those two markers with lung cancer is very low, very irregular, and it's worthless. So that's a worthless...
Very misleading.
It's a worthless marker. Now, prostate cancer, that says what? PSA. Now, that's a healthy marker. Ovarian cancer, CA125. That's a valuable marker. Testicular cancer, we were talking about that earlier, there are markers for other cancers. So you pull that down. So markers can be associated with cancers statistically, but that they're of worthless value.
Let me emphasize that. And the analogy comes to my mind as you're saying that is that in some ways, a lot of a physician's job is more like being a policeman looking for evidence of a crime. And you're going around, you're saying, okay, well, there's somebody broke in here and I need to take that piece of glass and look for fingerprints here and examine that there, and then I'm going to put the case together. But if you call the policeman up and say, hey, come to my house and tell me if there's crimes committed there, you're wasting your time. So people, hey, can you draw a whole panel of stuff and tell me whether there's something going on in my body that's wrong? I'm like, we're really wasting a lot of time here. There's a reason to go looking for something, and then just getting out the shotgun, drawing some blood, sending it off, and saying what's wrong is not the way to go.
You have just anticipated the next one,
Okay.
because this is exactly what Ray just mentioned. You see this here? This is an order test list And there's a liver cancer, colon cancer, prostate cancer, ovarian cancer, pancreatic cancer list that you could check all the boxes in that one tube, pull that thing down, send it off to a lab, and they would send you back a list of markers that might be in there. Now, first of all, insurance wouldn't cover it. And second of all, it's going to cost you an arm and a leg. And third, it ain't going to be any information that's going to do you any good. Mm-hmm. So that's exactly what Ray was saying. People can come in and say, I want you to do the, it's common for women to say, you know, I'm 75 years old, I've still got my ovaries, and I've been reading about ovarian cancer. Can you give me an ovarian cancer blood test? And the answer to that question is no. Now, when we get to liquid biopsy here in a minute, it ain't gonna be long before you might be able to.
Well, I might be able to, but I have a better smart ass answer than that.
A smart answer?
Smart answer.
Okay.
I slipped up there. Sorry. When I get asked the question, can you do a complete physical on me? My answer is, that's an autopsy. And we don't want to go there. Okay.
Okay. When he meant smart, he meant smart ass. Okay. All right. Put the liquid biopsy one up. Liquid biopsy is where stuff is going in many malignancies because it is non-invasive. You don't have to stick a needle in and worry about the lung collapsing and so forth. And you get the pictures up there. That's a pretty picture, isn't it? All right, so just looking at this one here, you've got a colon cancer, or you've got a breast cancer, or some other malignancy that has spread someplace. And when you do this liquid biopsy, you're now not looking for cells. You're looking for slices of DNA or RNA that are associated with specific malignancies. Pull that down. I think that the Cologuard test, which is
for colon
cancer, is a poor substitute for a colonoscopy, but it is for people that are scared to death, and it's a lesser cost. It doesn't look for cells, does it?
It looks for DNA.
It looks for DNA. Well, yesterday the announcement was the last 8% of the human genome, which has been decoded, has been decoded. So the entire human genome is now in the computer somewhere, and you can then find all these little slices of DNA or RNA. And that Cologuard test, if you just think about that and then think about that 1,000 times forward, is a way to take blood and then find these DNA or RNA clips that are associated with various malignancies. And let's put the next one up. Here is a cartoon. We call these cartoons. The absolute gold standard is a tissue biopsy. I mean, you got a whole piece of that thing, and you get a piece of it, you put it on a slide, and when you go through and make judgments, you're making judgments off of the actual tumor you are going to be treating. When you draw blood, a liquid biopsy, you are looking for fragments of DNA or fragments of RNA, or you are looking for actually circulating tumor cells, which do occur. You can look for metabolites so there's 4 or 5 different things that you can find in the liquid biopsy that you can analyze, and you can say this is there in a higher frequency than it should be, and that is associated. You can pull that thing down because it'll get complicated here in a minute. But that then is just drawing a tube of blood. It doesn't have much hazard. So remember, this question all begins with that it's expensive, right? That was the first thing it says. Okay, pop the next one back up there. There's 1,000 of these, not 1,000, just the dozens of these articles. What's that say?
What do you mean? Analysis of the cost effectiveness
of liquid biopsy.
Yeah, liquid biopsy.
Okay,
the analysis, right.
Of cost effectiveness.
That's what I want to know, is what makes this liquid biopsy so expensive.
Well, wait a minute. It's okay. Now, what's the cost right there?
$7,333.
Okay, now.
That's expensive.
Yeah, well, we got it down to $5,000. We got it down to $4,800. So, now, you're going to laugh, but I had a guy that was in the emergency room at the local hospital who had a piece of meat stick in his esophagus at a barbecue here about 3 months ago, who, when he went to the emergency room, he has a stricture. When they tried to get it out, he vomited, he aspirated, and they worked on him for about 20 minutes in the emergency room, sucking stuff out. He did fine, and he went home. He's a state patrolman. And the amount of his bill for that visit to the emergency room, which lasted 90 minutes in its entirety, 20 minutes of kind of high-intensity work on him, what the insurance company didn't pay was $8,000 for 20 minutes of acute working on his lungs, okay? Now, that's we pulled that down, right? That's $7,000. When you stick this needle in here in the invasive radiology department of a hospital, that's going to be $5,000 at least for the CT.
Just to go get it.
Just to go get it.
Yeah.
The analysis of it's going to be another $1,000, but 5% of those people are going to collapse their lung and have to go in the hospital with a tube for overnight, and that's going to be $25,000 for a few days. And a proportion, probably 5 to 7% of these biopsies aren't going to get enough tissue to make a diagnosis. So when you go back and you look at the cost effectiveness of the liquid biopsy versus adding together all of the costs of the easy ones that go easy, the ones that go easy will be less than $7,000, but the ones that are unsuccessful or the ones that don't go easy will raise it so that this actually is about 1/3 to 1/2 the cost of doing a tissue biopsy, and the insurance companies haven't gotten that message yet. You still there?
Yeah.
Okay, that's why, and these are very accurate. The liquid biopsy tests are very accurate.
But you still have honed down the audience. Who's going to get that test? You're not doing that to the general public.
No. You're doing that only to the guy who's got a diagnosis of cancer and you've got something you can't stick a needle in.
I mean, it's like there are a lot of programs about panning about the gold hunters right now, and they go to a place, a claim, and they want to figure out, should I dig here? They pan around a little bit and they see how many flakes are in the pan before they decide to spend some effort looking further.
Absolutely.
So you've already panned this person and said, hey, there's something going on here.
Right.
And we need to get intense now.
Correct. That's absolutely correct. So what's going to be coming? We're in a market here where we listen to Atlanta and Gainesville radio, sort of, and we have our television stations are Chattanooga and Atlanta, and there is a particular group that advertises themselves for a life scan for $125 that can give you a calcium score on your heart and can show perhaps things in your lung or liver that might be malignant. Now, we tend to discourage the use of that because when a radiologist reads it, he'll say, well, there's a scar in the lung, its confluence of shadows more apparent than real, but he's got to cover himself from malignancy. And so he'll say, this could be a chronic scar, should be followed, but clinical judgment's important. And then they go around, they stick a needle in there, and the guy collapses his lung, and that's worthless. The part of it that's beneficial is if they tell you your calcium score is 400, because that's not, you don't get hurt, you're not hurt then, and you don't have to stick a needle anywhere, but you got a calcium score of 400, you at least need to go see your PCP and talk about your heart. So we're used to this now, doing a scanning procedure with greater or lesser degrees of benefit. And I would tell people that do that scanning procedure to let your doctor look at the report. He's going to tell you to ignore 80% of it, but he'll tell you to focus on the calcium score. And if in the lung there's something that's 1.5 centimeters and looks like a cancer, that's worth it. But most of the other stuff is junk.
I'm going to echo that with emphasis. If you have a primary care relationship, that person can help you know where to, as we keep hitting on, where to go look or where to screen. Okay, in your family, in your sex, in your age, these are the tests that are more likely to find something bad or not. To go up to some truck or whatever that pulled up at the church or whatever and you pay them some money and they're going to screen you for cancer, you're going to get as much trouble as not. And Bill's whole point is you can have somebody point at something and then give you the hedge answer.
All right, now I want you to read from the day's news, because we discussed this in the green room. Read that one right there.
Screening CT scans for lung cancer have saved more than 10,000 lives.
All right, so okay, we're going to the medical news a minute, because this is important. Ray just brought this up. If you have greater than 25, 30, whatever it is, pack years of cigarette smoking, you have stopped less than 10 years ago, or you're still smoking, and you are over 50 years old, then you are eligible for a screening chest CT for the risk of lung cancer. And in the medical news today, right above is 10,000 or more lives were saved by this procedure in a year.
And the point is that this is not some van pulling up and saying,
Right.
hey, everybody come in here and get your lung scan.
Right.
This is a specific group of people. When you do it to them, then you save lives without creating more problems.
Correct. And then we're going to go one more place in the medical news, and this is for BKP. That right there is immediately above this one. And what does that one say?
80 tons of Skippy peanut butter recalled for bits of metal in there.
Okay, right. Well, the point I'm
bits of metal in the
point I'm
peanut
making
butter.
is that whole page of things there. The one about the screening lung cancer is really important. But it's right next to one about Skippy peanut butter.
I'm very concerned about my peanut butter.
Yeah, I know. And that's why I brought it up. But you'll notice that whole page is not a single thing in there about COVID. That's the point. Okay, so now we're back to this question.
So what is the article? Meaning you say
You've upset him, Bill.
no when you eat your peanut butter.
You're talking about his peanut butter.
No,
You
we'll
could
get
you could get your iron supplement at the same
get off the
time.
peanut butter. I don't know. It's
I don't
probably
know.
aluminum.
All right,
off
go.
the peanut butter. So back to this liquid biopsy. What I'm going to tell you to do is do what the oncologist said. Second, when you sign that paper in his office that says you might get billed, what he is not allowed to tell you is that every liquid biopsy company in America is pledged to not go back and put your family into bankruptcy. And so they'll either pay for it, they'll forgive you, they'll pick up the deductible, or there are other ways of getting it done. So is it your brother? Is it?
He's not allowed to tell you that. That's important to know, Bill.
Right.
Because
He's not allowed to tell
physician
you.
to physician, we know that we're not sending somebody into some sort of financial rape.
Right.
Right, I get that.
Right,
Okay.
Right. Now, his nurse may tell
But what bothers me, and I want to get to the second question, is that we're even discussing your health and financial possible financial collapse.
That crazy. Isn't it?
That's more troubling to me.
It is.
Yeah.
Okay.
But anyway, I don't.
But I appreciate you saying that, and I appreciate you talking about it also.
But I don't ever hesitate to order liquid biopsy, and
Okay.
I order them probably once every week or two, because I know that Foundation One, who does it, Caris, who does it, is not going to send you to the poorhouse. They're going to find a way to get it paid for, and the doctor's going to get the information he needs, and your family are going to get the treatment and the diagnosis they need. But somebody's going to have to fight them for it. So that, at the end of the day, get the biopsy done. All right, second question, and this is one that we don't have to spend all day on, but it is really interesting. We talk here frequently about chronic lymphocytic leukemia, which we treat by observation. I personally have prostate cancer that is being treated by observation. We have monoclonal gammopathy of uncertain significance, which is a myeloma-like disease that we treat by observation. So here's the next question. My father is a very healthy 78 years old until the week after Christmas, when he got very sick with confusion and went unconscious in less than 48 hours. He was hospitalized and had a high calcium and acute kidney failure, and he almost died. We were first told he probably had COVID, so that was when he was probably going into the emergency room and was so sick. I think it's reasonable for them to have tested him and said, look, your dad might have COVID, but we're going to keep him around here because he's next to unconscious. He tested negative.
Right.
And after bringing him back to life with IV fluids, what have I said before? You can't kill a healthy young Marine. Give them some IV fluids and he'll wake up. And that's exactly what they did. So they gave this guy IV fluids. They stabilized him from being unconscious. He had kidney failure and his calcium was up. And they biopsied his kidneys because he hadn't had kidney failure a month before, obviously. And he had light chain disease. So that's the whole question is here. What's light chain disease? He saw an oncologist after he went home, and he did not meet the criteria for multiple myeloma. So that's MUGUS, monoclonal gammopathy of uncertain significance. How have I told you treat that? You don't. You observe it. Well, here's a guy who's now been in the hospital almost dead, who's got an abnormal protein, but he doesn't meet the criteria for multiple myeloma. What's the rest of the question say? But he was started on myeloma treatment and is getting better. What is this about? That's a great question.
I have a quick question inside that question for both of you. You know, we get a lot of questions that say, my mom's very healthy. My dad is very healthy, okay? Is that the person observing dad? Dad looked healthy last week. Mom looked healthy last week. And then, like, you know, this one over here, hey, I just bumped into this guy the other day. He looked healthy as can be. Or can you go downhill that quick?
Quickly.
Yeah,
you can go downhill in 30 minutes. I'm going to use an example.
But you understand what I'm asking?
Yeah, let me give you a quick example. Well, first of all, they know the history of this guy.
Because obviously to the viewers, I look healthy.
Never mind.
Never mind.
A lot of time.
Hey!
A lot of time.
It's April Fool's Day. Go ahead.
No, I feel great. So, all right.
Okay, yeah, you feel great. So basically, they know the history here.
Right.
So they could, but a lot of times we'll get the question that says that he had a bypass 8 years ago, or he's diabetic and hypertensive. So this patient, I'm going to assume, is very healthy. But you want to know how fast you can go south.
Right.
Okay, just remember now, you got Marines and you got SEALs who are exercising and get rhabdomyolysis or in a coma in an hour. That's number one. Number two, you got a barracks full of cadets at Paris Island, and meningitis goes into the barracks, and they can be from well to dead in an hour to 2 hours. Okay.
Meningitis.
Meningitis. So acute renal failure shut your kidneys totally down, and shut them down bad, and be sick with dehydration. High calcium shuts you down. High calcium shuts off your head and can put you almost like you're unconscious. So yes, you can go south in 48 hours. All right. So here's the story. Put up the first one. Here you go once again. You've heard that lots of times. We talked about amyloidosis. Remember that's
it's a funky word.
It's a long, puffy word. You see that? You got the first one up there? All right. So amyloidosis, we've talked about before, is the deposition of this myeloma-like protein into stuff that I best say looks like honey or glue. And if it gets in your heart, you get a stiff heart. If it gets in your GI tract, you can have certain things. It can make you fatigue, get in your lung. Protein in the urine. Right, there's that one. Kidney issues is there. So pull that down. Remember now that myeloma is an abnormal protein in the family of antibodies. There are two chains on a myeloma, on an antibody, a heavy chain and a light chain. And the light chain goes out through the urine. So let's put this another beautiful picture up there. This is this is one kidney unit. You got the glomerulus, you got this long tube over here, and then it goes out through the bladder. You put 100 liters of blood into your kidney a day. 100 liters, now that's like how many 100 liters, let's see, that's 25 gallons or more of blood flows into your kidneys every day, and a couple of pints comes out through your bladder, right? So all that stuff is absorbed in these tubules, and that protein that is in your blood can plug up that protein, and that becomes light chain kidney disease. Take that down. So what they did was they stuck a needle in that guy's kidneys. They didn't know whether this part of the kidney was dead or what was dead, but they knew something wasn't right about the kidney. So, before we put up the next one, matter of fact, we might not even put up the next one. So what you've got is you've got a monoclonal gammopathy that under his normal blood would be a low amount, it would not cause any problems, and you would observe him. But for reasons that I don't understand and the nephrologist doesn't understand, only God understands, in some patients, a very small number of patients with monoclonal gammopathy, that protein chooses to plug up the kidney. Well, the only way you're going to get it out of there, if you're going to do anything other than take kidneys out and give him new ones, is to treat the protein problem, lower the amount, and let diffusion or natural breakup and healing work. So put up the next one. So this is the approach that we take to patients with abnormal, and then we're not going to look at this algorithm long, but you got people that are very low risk, that's the ones we watch, right? Standard risk or high risk. I have a guy that I had in the office this week who's in his 5th year of being monitored. You can pull that down for monoclonal gammopathy. He's a lawyer. He's in very good physical condition. And we are seeing him now at annual levels. I had a patient in yesterday that's in their 5th year. He's in his 5th year that we see every 3 months for the same condition. What's the difference? Well, one of them's protein's extremely low, hadn't changed a bit in 5 years, and the other one has a little bit more protein, a little bit more light chain, and a little bit of anemia. You know, it's got a little more. So we follow that patient more closely. Put the next one up. This was from a prior few weeks ago. We were talking about myeloma that we treat. You got it up there? That we treat with chemotherapy till we get the protein where we want it. In most patients, say anybody under the age of 70, 65, once you get them into remission, you offer them stem cell transplant because that's curative. You take out all the cells that make this stuff, give them back their own stem cells. That's a curative approach. But you can get just about as good a response, just about as good, not quite as good, with maintenance therapy. Okay, you can pull that down. Maintenance therapy is like you had a heart attack and you had a bypass, and now we're going to control your cholesterol and control your blood pressure and maintain you in that health. Maintenance therapy for myeloma is generally a pill called Revlimid, and what they're going to do with your dad is they are going to give him this myeloma treatment for 4, 5, or 6 treatments. That's going to be 1 month to 6 months maybe. Get him to the point where his response has been good, probably put him on a once every 2 week shot or pill, depending on if he gets an allergy to one or the other, and just maintain him and let God sort of clear his kidneys. Because otherwise the kidneys got to come out, not get transplant. They would not transplant him. He would go on dialysis.
Bill, we don't know why his kidneys were so successful to this, and they were more successful than the average Joe.
Yeah, there'll be 100 other guys with exactly that.
He could have put himself into a dehydrated state for a couple of days and just put a hammerlock on his kidneys and spiraled down. We don't know.
Yes, he could. I really think that is a possibility, but it's not the way we think.
We don't think about that.
Yeah.
But the big point is that the kidneys were really the rate limiting thing. You had to save him from his kidney death.
That's it.
First. And then you can go after the multiple myeloma. Now, are there genetic markers with the multiple myeloma now that show that some are more treatable than others? There's no.
Oh yeah. We definitely have a risk. We have stratification by risk factors and by what are called FISH testing and by genetic tests.
Okay.
But people who have this generally are not in high risk myeloma.
Yeah.
It's the light chain.
The light chain. Yeah. Very good.
Thank you, Georgia Cancer Specialist affiliated with Northside Hospital Cancer Center for these segments.
Well, we got onto this a little early.
Yeah, I don't want to gloss over the peanut butter thing.
I know what you do.
I want to go back to that. I want to ask a question.
Yeah.
Now I've heard. Now this is
This is April 1st, so I'm,
No.
I'm on the edge of my seat.
Yeah,
okay?
no. I've heard peanut butter is brain food. Right? Why do they say that?
It's got oils in it that are not in this trans fat harmful category. People who have bad fat deprivation, your brain is mostly fat, and so that is sort of a wives' tale. But there's a tiny grain of it's like your mother in the chicken soup. Because chicken soup really does help you, because the cartilage in chicken soup can help you make. So there's a little link in there. But we've talked about athletics before. The hockey game was on right behind us. You got a pregame meal for the football players or the hockey players or the basketball players generally 4 or 5 hours before the game. But 120 to 60 minutes before the game, there's bagels, toast, honey, and peanut butter that's in the locker room there, because that peanut butter, those bagels, and that honey, they are going to be able to convert into energy during the event. So peanut butter,
It's a nice balance of fats, proteins, and sugar.
There's peanut butter in every professional locker room you have ever been in, and you were talking about eating it with a spoon. They eat it with a spoon, or they put it on a bagel that thick.
When you were a little nerd and the teacher called you to fix the projector because you were the one that knew how to do that in fifth grade.
Because I like peanut butter.
You were the one that ate the peanut butter, and they just go together like.
I was wondering where we would get that, because I'm wondering if my high level of intelligence, I can attribute that to peanut butter, and I did fix the projector.
Right, we were talking in the green room with our sportscaster over there about why the coach Arians of the Tampa Bay Buccaneers stepped down, and he said that it was a political move to accomplish a goal. And I'm going to read this next not about the deodorant getting recalled, because I don't care anything about
What deodorant's getting recalled?
Suave deodorant due to benzene levels.
Good.
Okay,
It's not me.
No. All right. Now that one is
Wondered why he was a little standoffish this morning.
Yeah, all right. So Florida to get $870 million from CVS and drug companies in the opioid case. Now, here's the thing. I'm board certified in addiction. I ran the largest narcotic treatment program in the world between 1969 and 1972, and I'm published in the field. I believe that there was a marketing tragedy in the Purdue Frederick company, with oxycodone being sold to orthopedists and family docs and flying them out to Hawaii and just telling them it was going to be as safe as Tylenol. But when you find out that Florida's going to get $870 million, remember I was involved in the tobacco legislation for passive smoke in the aviation industry. And the amount of tobacco money that Florida got was $500 million. And that $500 million was to be targeted for smoking prevention education in children, but none of it went into medical care for people with emphysema and lung cancer.
Right.
This is all of this money is going to be used in, quote, prevention efforts, treatment, and recovery services. Now, we just saw in the paper day before yesterday that probably a third to a half of the COVID payroll relief money was stolen by people who created these foundations and said they were going to take care of. They had all these employees. I guarantee you that money, they're going to be more people coming. People are going to come out of the woodwork, and they're going to establish a drug abuse, narcotic recovery program that isn't going to exist, and they're going to steal half of that money, and the rest of it's going to be setting up worthless bureaucratic.
There are things in medicine that have degrees of effectiveness, They maybe help a little or a lot.
Yeah, blood pressure helps you not have a heart attack.
So, and you intervene there and you get benefits. I can tell you there's an area that has zero effectiveness, and that is making someone else stop their addiction. I've never succeeded. I've never succeeded or seen anyone succeed at making another person stop their addiction. That person who stops their addiction has to do it themselves.
Has to want to do
Oh,
it.
I agree with that. I agree with
it.
Yeah, I agree.
Nobody can intervene. Nobody can make them. Nobody can step
Well, you
in.
can intervene. Now, you can have. Okay.
Okay.
I just did this yesterday. You can have interventions where the family gathers around. They get the employer. They get all of their friends, and then they go and they say,
Yeah, but
AKP,
they have to.
Right.
Once that's
They
done,
have to hit the wall.
it has
Yeah.
to trigger something
That's
in that.
correct. That's correct. But I'm going to finish because a well-done intervention. You then go to that person and you say, we have you a bed at such and such a hospital, and you're going there right now for getting in a hospital. What they have done is they have taken every escape route that patient has, every friend, guy they go drink with, their employer, and all family members, and they have to be on board. Otherwise, that person could say, no, somebody's going to come pick me up. When there's no place to go and they take them there, they sign them in against their will. They got 72 hours to try and get them to come on board. Now
But they got to come on board.
to come on board. So I didn't want to, because you can intervene.
You can intervene.
But if that,
Yeah,
but
I misspoke. You can intervene.
It's not going to work.
It's not going to work
It's not
until
gonna
that
work.
person inside says,
Correct.
I'm done with this
But
sickness.
because I don't want to discourage families from trying to get your family to be on it.
I've been working.
Well, I understand what you said, and I clearly
Well,
understand.
He's exactly right, but there's a step between what he said and what I'm saying. We're linked to them together there. Anyway, that's good. Right?
I've been working on a joke for you this morning.
Well, wait a minute. We got to give the how many deaths from COVID in Fannin
I thought
County?
COVID was done. Look, are we
we
supposed to
ain't
talk
finished.
about Ukraine now? I got the memo now. COVID's done.
Zero deaths.
It's all Ukraine.
0 deaths. There
Zero
you go.
deaths.
Oh,
And
okay.
what was the positive test rate? I showed
20
you.
something
20%. So at
something?
20% positive tests, nobody died. And what did CDC do yesterday about cruise ships?
Well, I don't know what they do.
They've withdrawn their advice that people shouldn't be going on cruises, and said,
So they're going to
about it.
quit trying to financially destroy a whole industry.
Yeah, and what
But we're
did they-
still wearing the face diapers on airplanes.
Well, I know that. I hope that goes away next month too. And when the state of California yesterday said you don't have to show your vaccine and booster card to go in McDonald's or any place to buy food, you realize that they wanted you to show a booster card to go into McDonald's? You could go to the drive-in window, but you couldn't go in without your booster card.
That's a whole weird place out there. Okay, you ready?
Yeah.
Yeah, I'm ready.
I had a dear patient who traveled with her grandson, and they stopped at one of my favorite places, big sporting goods store. I won't name it. You can picture it. Something about Bass, something. Anyway, so this lady was in that sporting goods store, and she was getting her grandson want to get him a rod and reel, and she saw the clerk, and she said, well, sir, I don't know anything about fishing. Can you help me? And he goes, well, ma'am, I'm blind, but if you pick up what you want over there and drop it on the counter here, I can tell you what it is and give you some advice on it.
Okay.
He said, wow, okay. So she picks up this rod and reel, and she goes, drops it on the counter. He goes, well, that's a 10-foot fiberglass with a Zebco 404 reel with a 10 test line in it, and it's a good all-around fishing gear for a young beginner. She goes, wow, you tell all that from just the sound? She goes, yes, ma'am. She goes, and he goes, and it's on sale right now for $20. She said, well, I'll take it. So she reached in her purse to get her credit card, fell on the floor, and she reached down to pick it up, and he said, I think that's a MasterCard, ma'am. And she goes, wow. And while she was shuffling around getting ready, she let go of a little gasp, a little fart, and she thought to herself, well, he can't see him. He doesn't know who did that. Anyway, he rings her up and he goes, well, ma'am, that'll be $35.50. She goes, well, I thought you said the rod and reel was $10. And she said, $20. And he said, yeah, well, it's $20, and there's $10 for the duck call and $5.50 for the bear spray.
The duck call and the bear spray.
Yeah.
Not the duck.
All right. Where in the world did
The
you get
duck
that
call.
joke?
The duck
You can't get that.
The
on
duck call in the bear spray.
You can't
Oh,
get
my
that joke
God.
online anywhere. I know.
I have
Okay.
a very twisted mind.
I don't do jokes.
35
Next
bucks.
next week.
20
I'll-
for the rod, 10 for the duck call, 5 for the bear spray.
Next week, I got to tell you about the guy who couldn't tell jokes in the prison.
All right, I'm waiting.
Okay, well, you got to wait a week for it.
All right.
All right, so folks, Ask the Doc with Dr. William Whaley and our good friend, yes, Dr. Raymond Tidman, and he has jokes, like, he has jokes.
Are we Abbott and Costello or Mutton?
I don't know. There's people that want to be doctors, and there's people that want to meet and know a doctor. I'm the guy that just wants to know these doctors. I can't read half of these words you roll off. I'll tell you, we're going to go. I sit here in amazement of how you could say on and 12 syllables behind it.
Can you imagine
and
if
never,
you could do a vocabulary count of Bill's mind?
do you see him ever stumble in it? No, you don't. You just roll it right off. I'm amazed.
But when you do start stumbling, we're on you.
How about mumbling?
You start mumbling
Mumbling
to
or
yourself,
stumbling.
answering your own questions, then we're you.
Folks, Ask the Doc with these two. We always enjoy it every week. You guys, you have to get to work. You got to enjoy the weather. We all going to enjoy the weather in Blue
blood.
Ridge. Donate blood, and we're going to be right back with the All-Star Political Panel. Take a break.